Hi, my name is Sivaditya.
Hello everyone, my name is Reet.
And my name is Shaurya.
We are here today to talk about MISC. COVID 19 is no stranger to our ears. For the past 11 months, we have been trying to keep ourselves safe from this disease. Though you may know the symptoms of COVID and how to prevent it from infecting you, there is a condition that specifically targets children, and its name is MISC.
If you want to learn about medical mysteries, well, check out our podcast history. We've got the dancing plague of 1518, MIS-C, and more. If you want to learn about medical mysteries, well, check out our podcast history. We've got things on bewitchery, memory, parasites, and more.
You may be thinking, how is MISC connected to COVID 19? We will get into that soon enough. Let's backtrack a bit for about 9 months to understand the known origins of this condition.
MISC was not identified and was thought to be the Kawasaki disease and such inflammatory diseases, but was later identified. As we have mentioned earlier, the origins are unknown.
Though MISC is not a widespread illness, it is nothing to take lightly. There seems to be some kind of connection between it and COVID 19. COVID 19 exposures and antibodies seem to play a role in the formation of the syndrome. Children who have it need urgent medical attention and need to be treated in a hospital.
Doctors provide excellent examination and treatment to cure the disease of MISC. In most cases, the patients will recover properly, though this is sometimes not the case. Children are required to examine with the cardiologist for a follow-up. The condition can create problems in the organs. Along with this, infectious diseases could arise as well. Furthermore, there are some patients who may begin to have coronary issues. Therefore, it is important to consult specialists for a follow-up after the treatment of MISC.
Thank you, Reet. I would also like to talk about the symptoms. With MISC, a fever will develop within 24 hours. Others will develop over time. Symptoms include diarrhea, vomiting, skin rashes, myocarditis, conjunctivitis, swollen hands or feet, swollen lymph nodes, respiratory problems, fainting, confusion, cough, sore throats, and strawberry tongues. Well, you may have never heard some of these symptoms. This is why we are here, and we will explain them to you. Myocarditis is the inflammation of the heart muscle. These muscles help pump blood and move the blood across the heart. Once inflammation happens, it is crucial to have hospital treatment. Complications can lead to heart failure. Strawberry tongue is a condition in which a tongue becomes bumpy, swelled, and has an even more reddish complexion than normal. Shaurya, why don't you add on to this?
Sure thing, Teju. In regard to residual symptoms, if the condition is left untreated, MISC can cause long-term organ damage. Even when it is treated, widespread inflammation across multiple organ systems remains. Often, children will need steroids and other biological drugs to suppress immune response.
I would like to add that a medicine called intravenous immunoglobulin, which contains antibodies, is often given as well. General symptoms remain, though to a lesser extent. Because children who have or had MISC have been around someone with COVID-19, be sure to be aware about the virus and how close it is to you. Adhere to the COVID-19 protocols, social distancing, and follow CDC guidelines. Also, there's a quick fact that I would like to add. MISC, the multi-system inflammatory syndrome in adults, is a variant of the syndrome that affects adults. Since MISC stands for multi-syndrome inflammatory syndrome in children, the C refers to children. MISA is for adults, thus we have the A. As MISC cases are increasing, children and adults are getting more vulnerable to get this condition.
Thanks for telling us that, Reet. Shaurya, how would we diagnose MISC, and how is this process similar to COVID testing?
Thank you, Teju. Patients with a high fever for at least 24 hours are taken for blood work. If the blood work indicates inflammation, to which there is no clear origin of the source, then the patient tested positive for COVID-19, and this may result in hospitalization if and only if necessary. This also applies if they're around someone who had it in the past 4 weeks. There is no specific test for MISC yet.
Adding on to that, there have been around 1,659 cases diagnosed for MISC. Amongst these, the deaths are only 26.
Given all this information about this disease, I would like to talk about ways to keep safe from this condition. First of all, it is important that you and everyone you are in contact with take COVID-19 precautions. This includes social distancing, wearing masks, potentially face shields and goggles, and etc. Do whatever you think seems fit. Make sure that your immune system is not compromised. Make sure that you get no fevers, colds, anything that makes you feel sick. Eat healthy and exercise to maintain good health. If you do happen to get sick with fever, cold, etc., make sure that you and your family members or anyone you live with stays home. If you are sick with COVID-19, stay home and seek medical attention. If the virus gets worse and complications occur, consult a medical professional if you feel like you have symptoms, COVID-19 or MIS-C.
We urge you to contact your doctor, nurse, or clinic right away if you or other loved ones are showing symptoms of MIS-C. Healthcare providers may monitor your heart rate, provide fluid resuscitation, inotropic support, respiratory support, and extracorporeal membrane oxygenation if needed.
Overall, we can recap that MIS-C is a condition which attacks mostly children. This is a medical mystery as its origins are unknown to the world and science. In order to properly understand, we can tie it closely to the condition of COVID. The ones who have MIS-C have had some sort of connection to COVID. Most times, doctors and specialists provide the best treatment for a long-lasting cure, though some side effects can arise. While everything is not certain for the multi-system inflammatory syndrome in children, that's why we call it a medical mystery. Today's advice of the day is to remember that we are in an environment where the times are harsh and safety is our number one priority. So, let's take the necessary precautions to stay safe and healthy. Our decision is in our hands only and it only affects our life. Thanks for listening. This was Reet,
Sivaditya Padmanabhan.
And Shaurya saying,
signing off from McNair Academic High School McMed Club. Make sure to subscribe and turn on your notifications so you don't miss out on our next episode. Follow us on our Instagram, which is at mic.med_, that is mc.med_, to see more of us. Stay tuned for more mysterious medical mysteries.
If you want to learn about medical mysteries, well, check out our podcast history. We've got things on bewitchery, memory, parasites, and more.